Millions of Americans rely on antidepressants and other psychiatric medications every day. But now, Health Secretary Robert F. Kennedy Jr. is calling for a closer look at how these medications are prescribed.
And it's raising big questions about mental health care in America. We're joined live by child psychiatrist Dr. Willough Jenkins. Thank you so much for being with us.
Thank you for having me on.
First of all, I'd like your reaction to RFK Jr.'s plan when you went to look through kind of the details of it.
Well, first, as a child psychiatrist, I really welcome any increased awareness and conversation about psychiatry and mental health. It's so needed. But what concerned me was that the conversation really included some inaccuracies, and I worry that it's promoting fear and going to make people more reluctant to get treatment, which is so needed.
Oh, absolutely. And for those of us who are not familiar, can you tell us how do doctors actually decide when medication is needed?
Yes, well, it's a very individualized process where we sit down with a patient, we look and do a very thorough assessment into what their needs are. Usually, if somebody has symptoms that are more mild, we're recommending other types of treatment for mental health, therapy, lifestyle changes. But when symptoms are really impacting their ability to function, they're not able to do the things they need to do, we call that more moderate to severe, and the research supports it. That's when we start having a conversation about whether medication could be appropriate. It's always a highly monitored, individualized experience. And there's a lot of very close follow-up that happens in these decisions.
So one of the biggest arguments from RFK is that these drugs are being overprescribed, or that they could lead to, he's saying, more school shootings and things like that because of the overprescription of these types of drugs. Do you see that in your practice?
Well, I don't see that in my practice, and honestly, the data doesn't support it. We have data that shows about 1 in 10 adults in the US are on antidepressants, but yet the rates of depression are higher than this. So I don't see it as an over-medicalization or an over-medication problem. I truly see it that we're still not servicing or accessing people who need the mental health care.
Well, speaking to that, doctor, do you think antidepressants can be life-saving for some patients?
Without a doubt or hesitation. It is something that I've seen within my own practice. It's something that's echoed by many people who have been on antidepressants. They truly are life-saving treatments for some people, but they are just one of the tools that we use in mental health and in psychiatric practice, but they are a very important one that we don't want to limit access to.
So is it dangerous, can you talk about that, to suddenly stop taking these medications? I heard that years ago. Has that changed, or can you kind of sort through what we need to know there?
Well, the first thing is, please don't stop your medication without talking to your doctor. The process of stopping and the decision to stop is, again, individualized between a patient and a doctor. Coming off a medication after a period of stability is a very common practice within psychiatry. If you've been doing well for a period of 9 months to a year, we look at seeing if you still need the medication. That is already routine practice. To do it, you might taper the medication. There are some medications that can just be stopped, but again, there's a lot of nuance, and it's very an individualized decision with you and your doctor.
I think the thing that concerns me when I see this is that we already have a stigma of people trying to go in and get help for mental health care. Depression, as you said, 1 in 10, but you think that number could be higher, suffer from it. It can be so debilitating, and I don't know that people understand how serious it is. Can you talk about that a little bit and how that plays out?
I think that's a very important point. And depression or having a low mood is something everybody can relate to. There's been a time when you've maybe felt a little bit depressed, but having a true clinical depression is an illness. It's a very, very severe condition that for times is fatal. We know it's the second leading cause of death in adolescence. That's suicide. And the rates for teenagers, I'm a child psychiatrist, are even higher for those that are struggling with depression. So it is very important that if you're a parent or somebody watching, that you make sure that you have access to all of the tools available to help your child. And medications are a very important tool to be considered. And there's a lot of very strong evidence for decades that they've been used and have been effective for some people.
Wow. Dr. Willough Jenkins, thank you so much for the insight and important information for, parents and everybody out there.
Yeah, thank you so much. It's a very important message to get out.
Thank you.